Hello, this is Scott. I'm talking on this video here. Um, I have high blood pressure. It's under control with medication. Um, I've been doing some research on high blood pressure and stuff and causes and found something interesting. Uh, the doctors don't know exactly what caused high blood pressure. They know the factors. It's chemical imbalance. It could be low potassium. It could be uh, magnesium, uh, just different minerals and vitamins that your body's lacking that can cause it. Uh, and your arteries and stuff, they got muscle that goes around them, and that can cause your blood pressure to go up. Um, Blockage from cholesterol or calcium buildup um, can also increase it. And this, as I've been doing a lot of research in the past few months on different items and stuff, and garden and stuff, and uh, found out certain herbs and foods and stuff like that will can counteract the uh, high blood pressure or hypertension, as they call it. Even the kidneys can cause high blood pressure. And with me thinking about growing a garden this year, I looked at certain food groups and stuff like that and found out that what you eat and stuff, um, just like blue grapes, the skin off of that will uh, remove the plaque in your arteries. Um, Garlic uh, at a high dosage will lower your cholesterol and uh, works on the artery for better health for your artery. Um, Onions, celery, bananas, potassium. Again, onions, you gotta take uh, like basically it looks like a half or maybe a full onion around that. So between the garlic and the onion, boy, you'd be smelling high heaven because I know uh, with garlic, you could actually smell it coming from your skin. Uh, and then there's this recent study, which I didn't know, and in some cases they got to do more studies. Uh, the base of your spine, where your head is, um, if your body's out of alignment in that area, it can create high blood pressure. And they're doing more research on that. And for that type of therapy, there's not too many chiropractors that are trained in that specialty. And they kind of accidentally stumbled onto this. And so they're doing more research on it and seeing exactly um, what other effects. And they said that other illness like in the organs and possibly some cancers with your body out of alignment will uh, can affect that too. So there's a lot of stuff out of there, and uh, knowing that the doctors actually don't know as much as you thought they did uh, in that area. I mean, they know the factors and stuff like that. Smoking. I know at one time um, with me smoking cigarettes had a tendency to bring up my blood pressure. Um, but um, so but if I don't go now, I know that it's not affected if I don't go over that. If I don't smoke over that amount, it doesn't. I gotta smoke a certain amount of cigarettes before my blood pressure will go up, and I found that out. And so, um, and stress is the main another one that's uh, what causes for high blood pressure. So I'm doing more research on that and uh, doing research on uh, different types of uh, foods that help reduce pain, uh, herbs and stuff like that. And I'm going to run experiments here and there with it and see what I can come up with and see what it does. Um, because I don't like taking pills, and if I can get off of it, some of it would be nice. Uh, and they're getting with some medication they're getting tighter with, and actually they're getting stupid with. But so I want to do more research on it, and um, I found out was researching with different doctors and stuff like that. Certain factors that causes high blood pressure and stuff, and with the fast heart rate, irregular heart rate will cause it. There's a thing if you drink a certain amount of water, will help lower your blood pressure. So I'm just gonna get back with my doctor, and we're gonna kind of have a chit chat. I know with the VA, they doctors I've had in the past were pretty good, but uh, anytime you're dealing with where the government's involved in care and stuff like that, um, you can get help, but they're going to go to a point. They're going to go where they can save money. So, I mean, you might not get the best treatment uh, through the government uh, care plan, and because they want to save money, so they're not going to spend. They're going to spend the least amount possible, and even if it's not the better interest for the patient. And that's just another thing about socialized medicine. It's the same thing. It's they're going to go to save money more than to give you the care that you really might need. And so that's just uh, with Obamacare. That's just another thing to think about. Uh, but I'll talk about this on another Obamacare or Affordable Care Act or whatever you want to call it. I'll talk to that about that on another video. Um, but yeah, I'm going to try to set it up and um, talk to some doctors and see where they can regulate and see how we can deal with this blood pressure naturally. Um, see if I can get off most of these medications. know at least one that I might not be able to, so we'll just have to find out. Um, so I said, if you come up any ideas that you come up with about lowering blood pressure or cholesterol, I said everything is under control. Everything is normal. I mean, there's times my blood pressure runs a little on the low side. So, but any research that you heard about, leave a comment, and you know, I'll look into it, and we all can learn. And I'll do off and on other videos dealing with medical stuff. And I say I'm not a doctor, and that's what might work for me. Doesn't mean it's going to work for somebody else, because every human body's different. I mean, we're not all exactly the same. So, okay, that's it on this one. Y'all take care, and thanks for watching this video. Please subscribe to my YouTubes. I got some on gardening and political opinion, and covering other areas. And feel free to leave a comment. Thank you.